Hi everyone. So it's Julia Bartrop here from Rebalance Chinese Medicine. So normally on a Tuesday we actually do how I've helped a client. Um, in fact, today what I want to actually do is talk to you directly about postnatal depression, because postnatal depression is actually becoming a really big issue. 1 in 6 women are actually suffering from postnatal depression, and I actually want you to know that you are not alone. I actually had postnatal depression with both of my girls, and postnatal depression is actually completely different from just the baby blues. So you can normally get the baby blues on day 3 when your hormones decrease, and you have a huge change in hormones. However, postnatal depression can actually develop at any time after you've given birth to your baby. It generally does begin in the first 3 months after you have your baby, but it can occur at any time within the first couple of years post birth with your baby. So there's a number of causes of postnatal depression. So it can be that you have a previous history with depression. It makes you more vulnerable to postnatal depression. This was the case for myself. So I had a history of post-traumatic stress disorder after I had my car accident. And then also, given both of the births with my girls were emergency C-sections, that also increased my risk of postnatal depression and also brought on the PTSD as well. So I wanted to let everyone know that postnatal depression is extremely common. It doesn't choose who it affects. It can affect anyone. But there are people that are generally more vulnerable to postnatal depression. And this is if you have had depression before, or if you have a history of anxiety, or if you have PTSD, if you have had or have PTSD, if you've had a really traumatic birth or labor as well, if your baby was premature or is unwell, or if your baby has extra needs at the moment, so they're super fussy, they're not sleeping well, and you're not getting much rest either. So all of these factors actually help to trigger PND. So PND symptoms is you can be feeling low a lot of the time. You can be trying to do things and just not feeling happy, just feeling depressed. Being socially isolated can also bring on PTSD. You can be teary, you can be irritable, you can be frustrated. Um, you can just feel like you're not coping as well, and like you don't feel like yourself as well. So I wanted to let you know that you are not alone. Many of us have actually gone through this, and I know many other health professionals have actually suffered from PND as well. And I actually really want to take the stigma away from PND. There is a way to get help, and number one, that is please get help as soon as possible. I'm going to put on a link at the end, which is the link to Beyond Blue, which is a quick quiz. And from that, you can actually get a score as to whether you may have PND. Sometimes we just think, oh, yeah, I'm just a bit moody, I'll pass. I can get through this. I just need to keep pushing. I just need to keep going. Um, However, once you do get help, things change. So just because you've got postnatal depression doesn't mean that you have to go on antidepressants either. There are many ways that we can actually assist with postnatal depression. But firstly, we need you to, one, do the quiz, and then two, if you do score high, please go and see your GP, because we can get you on a mental health care plan, and that gets you 1 to 10 visits, generally 5 visits, and then if you need to, up to 10 visits to see a psychologist, which is covered by the Medicare rebate, which is really, really important. Um, there are lots of other ways as well, so including exercise, getting nutrition, getting support, just making sure that you actually get some time. So if sleep is an issue, if you can trade with your partner and get them to get up to baby during the night, or even just organize for 2 hours where you can get out and just have a coffee or go shopping or choose to sleep or catch up with a friend. So I know for myself, after the birth of my first baby and having worked full time for many years, I sort of lost myself as well and felt very socially isolated. And Mother's Group didn't really start until my first daughter was 8 weeks old. And even then, when I got to the Mother's Group, because My first daughter had reflux and was vomiting and used to cry a lot and didn't really sleep during the day. I'd sort of get there and all the other mothers would just look at me because I'd always get there frazzled and a bit irritated. And, my first daughter would be crying and they're like, "Are you all right? Why won't you shut up?" And I'm just like, "Oh, will you just leave it, please? I can't, deal with criticism." Um, so it's really, really important that we do get help, because once we do start recognizing the signs and we get help, we can improve it because we know what is going on and we know that there's support and there's help out there for you. So, as well as seeing a psychologist, there's also different ways. So you can use music, you can use dance, you can use art therapy, you can see a psychologist, you can use meditation and mindfulness. It may be that you just need to tweak your schedule or how you're actually responding to your baby and to yourself, and be kinder to yourself and not put so much stress on yourself. So other aspects of P&D can also be if, financially you're going through a hard time or there's a lot of stress or trauma within the relationship. It can also be just having a lack of support, no grandparents or friends around to help care, and you're doing the load all by yourself. So acupuncture is actually really, really good for PND, and we also back this up with Chinese herbal medicine and diet and exercise therapy. So I actually get I myself, and also with my clients, I get them to do Tai Chi or even a bit of yoga, just gentle stretching and breathing. If we breathe, we actually oxygenate the body and it helps our mind to think as well. So this is just ways that we can help with PND. I do highly recommend acupuncture because it does completely clear out the system, helps clear blocked energy, helps you to become mentally clear, improves sleep, and can bring you back to yourself as well. So many women actually feel quite lost after they give birth and have lost who they are as an individual because our brains become rewired, and we're more focused on just taking care of the little person rather than ourselves. But to be able to help yourself and your little person, it's the same as in when you're in an aeroplane and they always say, please attach your oxygen mask before children. So taking care of ourselves is our number one priority, because then we actually have the energy and the strength and we get the joy of actually taking care of our children. So acupuncture, acupressure, and Chinese herbal medicine are really, really important, and we treat the individuals, so no one's treatment will ever be the same. It will be different depending on what happens on the day or what's happened during their week or how they present. And we're always going to treat the mind, the body, and the spirit as well. So we're focusing on always accompanying the mind, the body, and the spirit into all of our treatments, because by doing that, we're bringing the individual back to themselves as well, and we're teaching the body how to heal itself. So I hope you enjoy this post. I'm going to post the link to Beyond Blue with that questionnaire about signs and symptoms, and the questionnaire on PND, and you can get your score. Remember, if you are feeling really low and it's happening day after day after day and not just one day of the week, and it's continued on for more than a month, you may be at risk of having PND. Please ask for help, because as soon as we get help, we can assist you, and that's all we want to do. Take care, and I'll see you soon. Thanks. Bye.